Mental health is a vital aspect of our overall well-being, and Nigeria, like many other countries, faces significant challenges in this area. The country's fast-paced and often stressful environment, coupled with cultural and societal expectations, can take a toll on individuals' mental health. The pressure to succeed, to provide for families, and navigate the country's economic and political landscape can be really overwhelming, leading to anxiety, depression, and other mental health issues. In Nigeria, mental health concerns are often stigmatized, and seeking help is frequently viewed as a sign of weakness rather than a sign of strength. This stigma, combined with limited access to mental health resources and support services, can make the struggles of those affected really, really worrisome. Now, furthermore, the country's traumatic experiences, such as terrorism, communal violence, and economic hardship, have contributed immensely to a mental health crisis that demands attention and speedy action. You agree with me that despite these challenges, personally, I believe there is hope. There is hope by acknowledging the importance of mental health, encouraging open conversations, and providing access to support services. If we can do that, we can work towards creating a society that prioritizes well being and promotes resilience. In this context, coping with stress and pressure becomes a very vital skill, and seeking help becomes a sign of courage and self care. As we navigate the complexities of mental health in Nigeria, let us work together. People, let us work together to create a supportive environment that fosters healing, growth, and overall well being. Good day, viewers, and welcome to today's edition of the Health Watch program. I am Promise Njoku Adibe, your anchor, and to educate us more on the topic before us, which is mental health, coping with stress and pressure in Nigeria, and also how to navigate it, is none other than Dr. Olusegun Shoyombo. Did I get that name right?
Well, almost. Thank you. Shoyombo is the name. Thank you for having me.
Okay, Dr. Olusegun Shoyombo. Oh my
You
goodness.
have to you have to sing it like a song if you are going to get it, but I'm sure you don't have the time.
Okay, correct me one last time.
Shoyombo.
Okay, Dr. Olusegun Shoyombo. He is a consultant psychiatrist at the National Hospital Abuja here in the FCT. It's good to have you come talk to us, Dr. Shegun.
Thank you.
Okay, so viewers, let's take it bit by bit, but then we'll go with the speed of light. So, can you educate us on what mental health is and how stress and pressure can be a catalyst to triggering this thing called mental health?
Usually I like to start by saying what mental health is not, or what mental ill health is not. Because you have certain terminologies that people throw around: madness, craze, colo, and people throw all sorts of negative terminologies around, which play into the stigmatization that you talked about in your intro. And all of these things do not particularly explain what mental health encompasses. Mental health is that ability of an individual to cope with the normal stresses of life, because being alive in itself means that one will be exposed to certain normal stress conditions. Okay, you wake up in the morning, you have to prepare to leave for work. If you have children, you have to prepare them, take them to school. You have bills to pay, you face challenges, traffic, and all of those things. So there are normal day-to-day pressures of life that people face. The capacity to face those problems depends on one's mental health. It also affects our ability to contribute meaningfully to society. So as we all go through life, the aim is what? To realize our own potentials and to contribute meaningfully to society. So cope with normal stresses of life, realize your own potentials, and contribute positively to society. These are the things that constitute a person's mental health.
Okay, but then can you tell us, is there a difference between stress and pressure? And if there is, what causes both?
Well, maybe there should have been a third person on the panel, or a second person rather, as maybe somebody who majored in English. For me,
Okay.
stress and pressure basically refer to the same
Same thing.
thing. They are words that we will use interchangeably. I won't be surprised if we go and check and people have tried to define them separately. But I think that for the purpose of this discussion, and I'm sure to majority of our viewers, stress and pressure are words that they would use interchangeably.
Okay. Okay. So, but then what leads to it? What causes all of this
Stress
stress?
and pressure, number one is for us to acknowledge that they are a normal part of life.
Are they really normal part of
Oh,
life?
oh yes, they are. You see, when you gain admission into university, they teach you you don't understand, Abi? And then they
Sometimes.
publish examination timetable, and suddenly those things you did not understand, you began to understand them immediately. Why? Because exam is now in front of you, and that is a form of stress. So stress helps our normal performance. Sometimes we'll talk about fight and flight. So it is a survival instinct thing. So I tell people, you go to a function and usher tells you where to sit. When there's an emergency, is it an usher that will show you which way to go out?
Because
Not quite. It is stress that has helped you to survive that situation. So in life, we create stress to optimize performance. Otherwise, we'll go to school and there will be no promotion examination. They just pass on from primary 1 to primary 2 to primary 3. But we'll get to primary 6 and see that we have not learned anything. But by creating an exam, which is a stressful condition, it has optimized our learning. The same thing happens if you look at the sports people. You create competitions, you create training schedules. Why? To optimize performance. However, it can also become a problem when
okay.
it becomes excessive. Okay, so when stress becomes too much and people develop either maladaptive coping mechanisms, or the weight of the stress itself completely weighs them down one way or the other, then it becomes a problem. I hope I've not confused anybody. So first, we admit that stress and pressure are part of our day-to-day living.
Yeah.
It optimizes our performance, it helps us to cope, it helps us to even survive in dangerous situations. However, there are instances where it can become excessive and we can buckle under the pressure.
I'm sure our viewers out there are beginning to get the hang of it. Nobody's saying the stress will not be there, but then excess of it can lead to something else. That's what Dr. Olusegun here is trying to point out. Okay, Dr. Olusegun, let's look at Nigeria, because that's our focus. It's a high pressure environment. Okay, so how would you encourage Nigerians to be able to manage stress and anxiety in this uh, um, side of the country where we find ourselves?
Well, I will not agree with you that Nigeria on its own is a high pressured
Well, the pressure is
society.
everywhere.
I think it is everywhere. I don't think there's a single country in this world that you will pick now where those who live there do not think that they are going through one form of stress or the other. I get your point, though we are discussing Nigeria, but it also doesn't help when we make it seem as if our case is unique and we are alone in our despair. It's not like that in the other parts of the world, if that helps anybody. So, how do we cope? Again, let's start from how not to cope. If you find the situation stressful, if you find the situation difficult, what you do not want to do is to compound that situation. You don't want to make it worse. So we have positive coping mechanisms and we have negative, or what we call maladaptive coping mechanisms. So first is not to resort to maladaptive coping mechanisms. What are examples of maladaptive coping mechanisms? For example, taking to alcohol and other drug use. Nobody can drink away his sorrow. I say that all the time. When you are drunk and you sleep and you wake up, the sorrows would have multiplied and be waiting for the person. In other words, if you have economic challenges and the way you want to forget about it is to go and drink, the drink is not free. So you are spending money that you say you do not have. Then that what you have taken can affect your health negatively, your physical health, you become sick, you need money to treat that sickness. So you have actually compounded the problem. So in any way, so just to say that people should avoid maladaptive coping mechanism. Other ones are transfer of aggression to other people. We are all in this boat together and we are hoping that it will get better. And while we are waiting, while we are hoping, it's not for one person to transfer his own aggression or stress to another person, if you understand what I mean. But then how can we cope? You have to approach this in multiple trunks. First is to acknowledge that not everything is under your control. Not
Mm.
everything is under my control. I was not the one that determined that the price of tomatoes should go to the place that it went to. And I will not unilaterally be able to determine how far lower it gets. You understand? So you must first understand your limits as a person so that you don't begin to try to solve a problem that you do not have capacity to solve. But how can you cope with that problem? One is to analyze it and first come to terms with what can I change, what can I not change. For example, I can decide I don't want to eat tomato again. That is within my power. But if I go to the market and start fighting with the tomato seller, I'm only multiplying the problem. You understand?
Yeah.
So if we are discussing strictly in terms of the economic difficulties, each individual has to look at his situation. Two things: how do I improve my income? How do I cut my expenses? I'm using cable television. It has different grades. Abi, premium, family, this, that. If I cannot afford the highest, I can come down to the lowest. How essential is that to life? Okay, I can't decide, for example, if I am hypertensive and taking a drug for blood pressure and say, this drug is too expensive, I'll only be using it on Saturday and Sunday.
Of course not.
I can do that.
Yeah.
But I can decide to reduce my cable television subscription. I can decide to reduce what I use for internet subscription. So there are things that we can cut off in difficult situations. You look at your own personal circumstance and cut off the non-essentials, and they can always bring them back on when things get better.
Okay. Well, that's really that's a wonderful way of putting it. I love the elaboration, the way you really that. I'm sure Nigerians will take a cue from that. Okay, but then I want to know, presently in Nigeria, are there healthy coping mechanisms for dealing with trauma and PTSD?
Now, these are two big topics: trauma, PTSD. PTSD is post-traumatic stress disorder. It means somebody has been faced with very severe trauma, life-threatening trauma, and is having reactions to it. Let us talk in more general terms, that when people have mental health conditions, is there help available? There is no coping mechanism that is peculiar or particular to Nigeria as a geographical location. The principles are universal. You understand? And then there's no need to talk about individual conditions like PTSD, like trauma. I want to believe that it still makes sense to talk about them as a general term. Help is available. That is the first thing I will say to people. There are professionals, there are psychiatrists, psychologists, mental health nurses, social workers, community health extension workers, general practitioners. Help is available. There are places that people can go to and they will get the kind of help that they require.
Okay, can you just for the sake of our viewers out there, can you just mention one or two of those places where people can go to seek help?
Maybe I can mention 20 or 30.
Oh, beautiful!
If you have
okay, just a few will help.
Number one, if somebody is feeling unduly pressured, if somebody is feeling down, feeling hopeless, or having any other symptom of a mental health challenge, or indeed any health challenge, they should go to a hospital near them. If somebody particularly feels that he needs the services of a psychiatrist or a mental health professional, there are a number of strictly mental health hospitals around the country, but almost, in fact, I'm sure every teaching hospital around the country has a department of psychiatry. So, for example, we are in the FCT. National Hospital has a department of psychiatry, and we admit patients. University of Abuja Teaching Hospital, Gwagwalada, they have a department of psychiatry. The FCT has an entire hospital dedicated to mental health services in Karo. The General Hospital in Karo has a behavioral section, and that's what they do there majorly. The FMC in Jabi has a department of
Oh.
psychiatry, but I believe we have viewers from far away from Abuja, and people in different places can go to the teaching hospitals, federal medical centers, general hospitals. Please, if somebody needs the services of a mental health professional and he doesn't know where to go, the first place to go to is the closest hospital to him. Most likely, the doctors there or the practitioners there will be able to point him in the right direction to go.
Oh, beautiful. Thank you, Dr. Shego. Well, viewers, you just heard him. Virtually every government hospital have such departments created for, for anyone who requires such services. So please make sure you explore such. And if you have someone who needs such information, feel free to give out this information. It will go a long way to help people out there, because people are truly going through a lot. We know that people are going through a lot in this present time. Okay, but then I want to ask, look at in my opening I talked about stigma.
Yeah.
Okay, so how can Nigerians, because this stigma, talking about mental health discussions, like you rightly pointed out, a lot of people see it as the moment somebody starts talking about mental health is now madness or something. How can people overcome that fear and talk about it?
What I have to learn from my experience with COVID
Okay.
and HIV.
Okay.
With HIV, we had years of serious stigmatization. Everything was hush hush and aiding, but the attitude towards it is better now. When COVID came, I remember the first few cases of COVID where they had to go and pick somebody from the outskirts of Abuja, and for weeks the neighbors kind of ostracized that family and that area. So stigma doesn't help anybody. So when it comes to mental health, also stigmatization prevents people from seeking help. It prevents people from speaking up and getting the help that they need. So we all must avoid that. We need the media. We need the Nollywood.
Hmm.
Nollywood is a major culprit in the wrong depiction of what mental illnesses represent. And Nollywood has a huge consumer base. If they pass out the wrong information, it will be taken as the norm. So if our producers and script writers will do a bit more research, talk to professionals to guide them. If you want to depict something in a movie, can you get a professional to advise you on how to do it so that people don't have the wrong notion? Mental illness is not all about running naked, wearing rags, or being violent. In fact, the mentally ill patient is more likely to suffer physical abuse than he is to physically afflict somebody. That is the truth. You see a mentally ill woman, vagrant, roaming the street, pregnant. Who got her pregnant?
Yes,
Sexual abuse. So there has to be a proper orientation. We have to put out the right information across to people. People also have to realize that it is an illness. Mental illnesses are just illnesses like any other. Anybody can be ill. Somebody who is well today can be unwell tomorrow. How would you want to be treated if you were that unwell person? How would you want to be treated? Would you want to be abandoned? Would you want to be laughed at? Would you want to be chained and beaten, starved, physically abused, sexually abused? If you would not like to be treated that way, then you should not support or advocate or in fact treat another person that way. So, and then there's a new mental health law and people should be aware. And that law protects the rights of people with mental illnesses. So somebody should not suffer discrimination on account of his health. You employed somebody to do a job, he's doing the job, and then unfortunately has a mental breakdown that is treatable, but because he has had a mental health breakdown, you suddenly feel that you can no longer have him on that job. I agree that there may be a few occupations that are very sensitive where they may not be able to permit somebody with certain kinds of illnesses. I mean, there are other illnesses. For example, if somebody has a seizure disorder, we'll say, oh, don't swim, don't drive, don't do, because of the dangers inherent in it. But overall, we'll say that people should not suffer discrimination based on their health, including their mental health. So stigmatization is a very broad but very important topic, and it starts with each individual. Each one of us has to think about it. What do I do that stigmatizes the person with mental illness, including our snide remarks and crude jokes that we make? Does it really help the situation? If you want to abuse somebody, it is you are mad. Why don't you abuse somebody by saying you are diabetic or you are hypertensive?
Or you are rich.
Or you are rich. Why use mental illness as the yardstick for abuse? That nobody, if people want to get married, they say, let's go and investigate that family. They don't investigate that family, whether there's diabetes there, which clearly has a hereditary component. They don't investigate whether there's hypertension. They don't investigate all those other things. What are they looking for? They're looking for mental illness and all that. So those are the kinds of stigmatization that have become entrenched in our societies that we must all fight against.
Okay, I'm glad you went further to talk about people getting married and then the whole such things about mental health and all that. So are there roles, cultures, and traditions can play in helping to eradicate the stigma associated with mental health and behavior?
Absolutely. A big role for culture, a big role for society. Number one is to first treat people with respect. Every human being, including the human being that has a mental illness, treat them with respect so that people don't have to hide. Again, let us go back in history. Once upon a time, if someone had delivery of twins, the babies would be killed because they were perceived as evil. Okay? It was collectively being done in society. But then you will see that the person who has the twins will not like the idea that they are killing our children, and people will try to hide their own children from being killed. So those who are the receiving end don't find it funny. So society must find a way to make sure that we do not discriminate, we do not make fun of people, we do not deny them of their own rights. A person who has a mental illness has a right to rent a house. You don't say because you know that one time because he had a mental breakdown, then as the landlord said, no, I don't want you as my tenant. Is it well at that moment? Of course, in a state of ill health, it's unlikely to come to you to want to rent a house. And if it's clearly unstable, you have a right to say, no, I don't want to rent my house to an unstable person. But you cannot just on the basis of a history that you know. I'm a doctor, I've treated people. So if I have a house and a tenant comes and wants to rent, I say, this one I know. Or I'll go and whisper to you and say, I know that person. Those are wrong things to do. So society has a big role to play on every count. Let us talk about religion. So we are talking about stress, we are talking about pressure. Those who buckle under pressure, is it because they are weak? Or is it because they don't have faith? Because there are spiritual languages that we can use that sound nice and cliche, but we do not realize that we are stigmatizing people and we are further making their situations worse when we make a depressed person feel like he is ungrateful. Why are you unhappy? Can't you see what God has done for you? There's difference between unhappiness and depression. Depression is an illness. If somebody is pregnant and nauseous and vomiting and doesn't have appetite to eat, you don't go tell that person that, can't you be grateful that God has provided you with food? Just eat. Why? Because you understand that it is the pregnancy that makes her feel that way. In the same vein, the depressed person is not just an ungrateful person. So we must be careful. Another thing that entrenches stigmatization is when people don't have access to treatment,
Mm-hmm.
and the illnesses get worse, and then people see the very terrible manifestations of mental illness. It makes people scared of anybody with a similar illness. But when people have access to treatment and they do fine, every other person is encouraged. So you come to the hospital and then you see a very sick patient, and then you see another person that will come to you and say, oh, I have somebody like this in the house. Can I bring him? I didn't know that they could treat this problem here. And they will bring him. So back to the religious organizations, back to our churches, people should not be discouraged from taking treatment. Having faith is not a reason not to take medications. I am wearing glasses. There are many pastors that wear glasses. They should first, with faith, throw away their glasses before they tell anybody not to wear, not to take medications. You understand what I mean? So people should be encouraged to take treatment. If people get treated and they feel good, the stigmatization will reduce.
But there's a saying that once a mental person will always remain a mental person. Now, as a psychiatrist, I want you to elaborate more on that, either debunk it or just give us a better clarity.
The first thing we'll ask whoever says it is, what is who is a mental person? Who exactly is a mental person? There are many illnesses under the rubric of mental illness, many independent, unrelated illnesses. A child is born and has autism or attention deficit hyperactivity disorder, or somebody has a sleep problem, or somebody suffers some difficulty in life and develops an anxiety disorder or depression, or somebody has bipolar or schizophrenia. What else are we referring to as mental? Because there are several conditions that people have. The real question would be, who is not mental? Who is not dealing with one thing or the other? However, most of us will not meet the requirement for a formal diagnosis to say, oh, you have XYZ disorder. Once a person has been treated, the person has been treated. There are illnesses that are episodic. They go and they come. The essence of treatment is to prevent such an illness from recurring. So when that person is treated and the person adheres to the treatment protocol, it is unlikely that he will have another episode. So again, the non-adherence to treatment, the poor attitude to help seeking are the things that entrench such beliefs. Once mental, always mental. Why? Because he had an episode 2 years ago. He had another one last year. He has had another one 6 months ago. He's having another one now. The problem is he's not taking treatment. It's not because the assertion is true that once mental, always mental. We've treated people and we've successfully taken people off medications for some conditions. Some people have been on treatment for a very long time. They continue to require to take their treatment, but they are well. Wow. So people fall into different categories.
Oh, okay. Well, viewers, you had it clearly there. This is not just any kind of person talking to us. This is a psychiatrist, a consultant, and he's talking with every authority. So that assertion of once mental, always mental, please take it off your mind. He has just debunked it. Now take it off your mind. And then, of course, you know where to seek help when you have such issues. So if you have anybody around you that is dealing with this, with depression, with anxiety, please, the earlier you seek help, the better. The earlier you seek help, the better. He's made mention of places where we can seek this help. Please, let's make do to do that. We'll be going on a short break. When we come back, we have some more questions for Dr. Olusegun. Don't go away.
Now streaming, now analyzing, now assessing, now discussing, now sharing your thoughts on everything and every issue that affects you. ACNN is now streaming, discusses the issues trending and the matters that matter to us all. Join us every Monday to Friday at 10 a.m. on ACNN as we go in-depth into every issue that impacts our lives, our communities, and our country.
Welcome back. If you are just joining us, this is Health Watch program coming to you from ACNNTV. I am still here with Dr. Olusegun. He is a consultant psychiatrist from the National Hospital here in the FCT. And we've been talking about mental health, coping with stress and pressure in Nigeria. And believe me, he's made so much points. In fact, he has done a whole lot of clarification about some things we used to believe that was true before. But hearing from an authority like him, we've got to understand that those beliefs are really not it. So, Dr. Olusegun, I'm back to you. You know, you talked about the last question I asked you before we went on break, if once mental, always mental. You made a whole lot of clarity there. But I just want to ask, looking at where we find ourselves in Nigeria right now, how the whole pressure and everything. Are there specific ways one can navigate the challenges of living with a mental health condition in Nigeria? Are there specific
So
ways?
again, we must acknowledge, again, I assume that you are talking about our socioeconomic difficulties.
Mm-hmm.
We must acknowledge that these things have an impact on people's mental health.
Mm-hmm.
Mental illnesses, by their nature, are stress related. Socioeconomic stress is an important stress factor for several mental health conditions. So, yes, we acknowledge that it can make an existing mental illness worse, or it can indeed precipitate a mental illness in somebody who did not previously have it. These things are well proven. What can the individual do? Maybe we should start with what can governments and organizations do. Well, what they should do is to improve the socio-economic situation, is to create social safety nets. People should have reprieve from time to time from the pressure that they feel. If you continue to strike someone endlessly, eventually you would make a damage to that person. So from time to time, government has to intervene and make sure that people are not pushed beyond the edge that they can withstand. And that also goes to organizations. So you put buffers where you can. Sometimes it's a little bit of addition to what people earn, or creating more flexibility with work, creating a work-friendly environment. And then, there was a time when some governors said people should come to work 3 times
A
a
week.
week, 4 times a week, thereabout. Those kind of initiatives just to reduce the pressure that people face. But at the individual level, everybody would know where they feel the pinch and seek what adjustments they can make. But collectively, and I like that in your intro, you gave a message of hope. That is the currency that should not run out. We all have to hang on to that hope that things will be better and play our individual parts in it, because not everything rests on government. We can blame government from today till tomorrow. It doesn't change our situation.
Yeah.
So we all must take responsibility in the ways that we can. When you drive on the road and throw paper out of your car, how are you helping to solve any problem? When you drive against traffic and make somebody who has had a bad day, you make his day worse, because now you've had a hectic day at work, but because of somebody's irresponsible behavior, we are spending long periods in traffic. How does that help?
You can even, hit your car.
Yeah, so at the individual level, we all have to take responsibility not to make the situation worse for the person who is next to us. And like I said earlier, each person looks at his own situation and makes necessary adjustments. Sometimes they are short-term adjustments. You may have to downgrade the school or housing or type of car or type of phone. Just lower your standards a bit. Let's keep our heads above the waters. When things settle down, we'll go back to our preferred level.
Okay, well, that really cuts it out for me. Well, viewers out there, you had Dr. Shegun here. Take it easy, take it slow. Everybody's passing through stress, through pressure, but then one step at a time. Take one day at a time as it comes. And as much as possible, try not to make the other person out there feel bad with your actions. Okay, so let's always take it easy. Now let's talk about these traditional healers, because we've had people come out as traditional healers or spiritual leaders. You know, they tend to heal people with mental health. Is that really true?
What authority do I have to say whether it is
No,
true?
like, I mean the healing process. Are they really getting it? Compare vis-a-vis what you are
all I can say
into.
to our viewers is, please, if you need treatment, why don't you seek evidence-based treatment? Why don't you seek treatment in a place where people can be held accountable? How many people have taken Babalawo to court that the treatment failed or had an adverse effect on the patient? But they do that to us all the time. You petition medical and dental council, you write police, go to this, you put doctors under a lot of scrutiny. It is that scrutiny that has helped medicine to develop to the level that it is, and it is that scrutiny that will continue to improve the standards of care that we give in hospitals. I cannot speak to what they do in those places, but I can let our viewers know that a lot of people come to us severely damaged, having been to some of those places. Because, for example, somebody says he's treating staphylococcus. Is that a Yoruba word or is it a Gbagi word? So first you are treating something you don't know. You are a naturalistic healer, but you don't even have a name for the illness that you are treating, that you are supposed to be treating. And then it is the same medicine for X, it is the same medicine for Y. We tell you to drink a little bit, then use the rest of it to wash your hair and all that, and then you get your healing. I don't know how it works. Maybe some people get their results from them. We also know that some people, some practitioners get medicines that are used in hospitals and put in concoctions.
Oh my goodness.
For the people who come to them. So the people who go to them are actually taking medicine that they would have taken in the hospital, except that they are now taking it from somebody who actually doesn't know what he's prescribing, or what dose he should prescribe, or what safety measures he should watch out for before prescribing those medications. And sometimes it is when they develop side effects. When they come to hospital in a certain way, we know that they have been exposed to a certain type of medication, although they will come and tell you all they'll be taking is herbs and all of those things. And again, you look at those places, what's the hygiene? What's the standard? So those are the kind of places where people get chained, where they get beaten, where they get sexually abused. How is that a proper treatment center? And like I said earlier, the question each person should ask himself: should I fall ill tomorrow? And anybody can fall ill. We all pray to God and have faith that we'll remain in health. Should I fall ill tomorrow with this kind of condition? Would I want to be treated in that kind of place? If the answer is no, then you have no business taking another person there.
Agreed. Okay, but you have some people argue the fact that before we had this modern form of medication, we used to go, to the herbs and all of that. Do you think that worked those days? I really
You want to set me up?
I'm just asking an innocent question, because
No,
that's actually the defense they give.
The truth is that they must have worked for some people. The reason why traditional medicine has not developed much is because there hasn't been a lot of documentation, and it hasn't been subjected to scrutiny. This other type of medicine that we advocate and defend and do and where I work is because of the scrutiny it has been subjected to. You can buy a drug for headache today, and you pick out the leaflet and read about it. It will be written there, manufactured by, packaged by, manufacturing date, expiry date. They will list their side effects for you to look out for. They even list there the conditions it is used to treat, and they will list their drugs that it can interact with. And then they'll say, if you have this condition, please discuss with your doctor before you take this medicine. When you go to the man inside the Peugeot 504 and a speaker on top of his car, and you buy a bottle of something that is greenish blue, do you see all this information there before you start taking that? So if we can bring it to that level of scrutiny. Now, before I can say that this can treat this, there's a standard of proof. There's what we call a randomized trial, a randomized control trial. We have to, there's first a safety measure. I have to first prove that it is safe. Then I have to now look for people who have that condition and give them that drug, and then compare their response with a standard for before I can say that drug works or it doesn't work. So if I pick a concoction and I say that it can treat staphylococcus, I have to ask myself, what is the standard for the treatment of staphylococcus? And I'm using that because it's a very common thing. When you walk on the street in Wuse Market, you hear for staphylococcus, for staphylococcus. So I have to pick that concoction. Then I have to take what the standard is. Then get willing participants who have staphylococcus. Some of them will get the standard, some of them will get the concoction. Then I'll compare the results. Then I can say whether truly that my concoction works.
Okay.
So if we can't have that level of scrutiny, it's difficult for me to come here and validate what they do. But I would rather hide and say I don't have authority over them.
Well, that's the first way out of the net. Okay, but we're looking at the fact that we have some mental health centers here in the country, like you just outlined some few minutes ago. But then, how can these healthcare systems be strengthened the more, to do more?
So you know that we are in trouble. We are bleeding professionals. We are training people and they are jackpying. So we have a serious shortage of hands across all fields, from doctors to nurses to psychologists to social workers, speech therapists, name it. All the complement of professionals you need to help people with mental health challenges as well as other health challenges, we have severely short in terms of manpower. So one of the things we first need to do is serious manpower development. Not only should we be producing, we should be retaining. Right now we are bleeding, we are hemorrhaging. People are, if you go and talk to people in hospital management, resignation letters come in every day.
Wow.
And what are they resigning for? Because they are leaving the country. So that's first. Then we must address the issue of accessibility. Most of our treatment centers are in the cities and the urban areas. We have on paper perhaps one of the most fantastic policies to take healthcare to the people, and that is by using our primary healthcare centers. But implementation has been very poor. So we need to strengthen that so that people can have access to healthcare as close to them as possible. And one of the things we can do is to leverage on technology. So I work in National Hospital Abuja, but can we make it such that a primary healthcare somewhere maybe has a young medical officer working there, but maybe once a week or once in 2 weeks, I can provide tele-services. I am here and he is there, and we are seeing patients together, and I'm giving instructions and I'm saying do it like this, do it like that. There are other alternatives to consider. Can we create a cadre of people that will move around? One of my friends had to live in Cameroon for a few years, and she worked in an organization as a psychiatrist and was covering almost the entire country. All they had to do was to drive her here, and she would do 4 days, and they would drive her there, and she would spend 2 weeks, and they would drive her with interpreter and all of those things. Because if we think our situation is bad, just go and see what you have in the countries around us. So we have to make the best of what we have. So whilst we are trying to increase the manpower and we are trying to create access to rural communities and build new facilities, we have to find a way to use what we have in a judicious way. How can we take healthcare to the people rather than to wait for them
to
to
come.
come.
Because I was actually about asking these healthcare centers that you mentioned, do Nigerians really patronize such places? Do we have people coming in to have their mental health, checked?
So if it is in terms of mental health, you see that the penetration is still very poor. But you see that we've done a lot in terms of maternal health. Most
Mm.
people will go to a primary health care center near them and they'll be able to have decent antenatal care, deliver their children there, and with good outcomes. So we are not reinventing the wheel, we just have to key into that existing structure and let mental health benefit from it also.
But are these mental health centers? Are they really up to standard?
By all means, yes.
Oh,
Teaching
okay.
hospitals, federal medical centers, federal neuropsychiatric hospitals. And when we're talking federal neuropsychiatric hospitals, we are talking the likes of Aro, Yaba, Kaduna, Enugu, Calabar, Meduguri, Kwara, Sokoto, and then the new one in Ilorin. Is there anyone I've left out? Uselu in Benin. Okay, so the neuropsychiatric hospitals, a few states have standalone neuropsychiatric hospitals, as well as the FCT that has one in Cairo. Like I said, the teaching hospitals all have departments of psychiatry. Now, when we talk about standard, remember that hospitals undergo what we call accreditation.
Mm-hmm.
For hospitals to do postgraduate training, or in fact undergraduate training of medical students, they must have gone through a process of accreditation. And for that accreditation, there are things they go and check. Do they have this? Do they have that? Do they have this? Do they have that? So you can visit any of our psychiatric departments. It may not be as shiny and beautiful as maybe what you find in Switzerland or somewhere like that. But the basic things to give a person a decent mental health service, I'm sure, are present
Are
there.
present. Oh, that's good to know. That's good to know. So I'll give a kudos to the government for doing that. Okay, but now let's talk about awareness. A whole lot of people might not be aware, like a lot of things you pointed out here. People might not know that, oh, okay, mental health, you don't have to take off your clothes, you don't have to wear rags and all of that. So is there a way such can be mental health education can be, included in our educational curriculum to, raise more awareness and prevention?
I think that's a good suggestion. I'll take it as a suggestion. I don't know where to now channel it to, if it can be put in the curriculum. But I think that in a way, my own children too are young and go to school. Once in a while, they will come and there will be this discussion surrounding mental health.
Health.
But beyond that, is that on a lot of fronts, we need to create awareness in many ways. Inviting me here to have this discussion is one of the, do you know how many people we can reach
Mm.
here? Not only are people going to watch this program will now be shared on social media platforms and people will be educated through it. So I will also beg the ACNN to go and search out, and if they need our help, we will help you. You go and search out all the days commemorating different mental health conditions. There's World Suicide Prevention Day, there's World Bipolar Day, there's a month dedicated entirely to anxiety disorders, there's day for depression and things like that, and we can take advantage of those periods, even if it doesn't fall on that exact day. Those periods to create awareness on different conditions. On our part, in our various institutions, we reach out. We have an association of psychiatrists in Nigeria. Part of the conference every year would include an outreach, to just educate people and create some awareness in our own department in National Hospital, even though it is an intra-hospital department. We also engage in outreaches, sometimes just health education campaigns, even within the hospital, just going from point to point and using a speaker and a microphone to talk about mental health. And you see people that are surprised that the department is there. They didn't know that this kind of service was available. So everybody should make a difference in the way that they can. But public enlightenment is very, very
Very,
important.
very important. I agree with you. And then all our psychiatrists, the practitioners, are they, we upgrade every day. We learn every day. New things evolve. We evolve every day. Our practitioners always, are they up to date with the technological approaches used around the globe?
Part of the essence for having a conference every year for the various organizations, including our own Association of Psychiatrists in Nigeria, is to update ourselves. We don't just gather to eat and drink. Every such conference has what is called a scientific session. People present papers, people present cutting edge research that they have done, and we learn from each other. Part of the, and I would say that yes, people are leaving the country, but that itself has created an advantage where we now have conferences where people participate from other parts of the world. People who used to be here, but now they live in Australia, they live in Canada, they practice psychiatry in America, and they participate in a conference with us, and we rub minds, and they will say, oh, this is how we do it here, this is how we do it there, this is the result we get, and things like that. So we are up to date. There's also a requirement for registration every year. You know, every doctor renews his license every year. Every year you must, otherwise you are practicing as a quack and can get into trouble. So, as a requirement for renewing your license, is also a need to submit what we call a continuing professional development certificate. So you must have attended some courses, you must have learned some new things. Now, in the teaching hospital setting, on a weekly basis, people participate at least in a teaching session where people will learn from each other. What we call the grand round is like a mini scientific conference, and that goes on every day. So just to answer your question, that people should not fear. We get that all the time. When people travel abroad and come home and have to see us, you almost see that they are second guessing and doubting your abilities. Why should this doctor here be changing the drug that the doctor in Egypt wrote for me? Why should this doctor here be making a different diagnosis from the one the doctor in America? In fact, those American people will always come with a diagnosis. I got ADHD, I got ADHD. That's what they always call, you know. So but I think increasingly people are becoming more confident in the kind of, and we have very, very, very capable, absolutely capable hands around here.
Yeah, that's good to know. It's good to know. I believe Nigeria has all it takes. We have what it takes. We have the brains. Even if you go outside the country, it is Nigerians that are, making waves over there. We have all it takes to make this country the best. Okay, so I just want to know, do psychiatrists like you, do you offer online consultations and treatments, virtually? Do you do that?
No, that's a tough question because everything in medicine is regulated.
Okay.
Now, the area of telemedicine is where even government is now beginning to try to put some regulation and enablement. How do I answer this? Yes, sometimes it is necessary to do that. Sometimes there's no other way. I'll tell you, for example, I have a patient somewhere outside of Abuja, an elderly woman that I had seen a few times in Abuja, and then she went back to her location and there's no psychiatrist around her and she needs to be doing a follow-up care. And so we've been having a kind of a telemedicine kind of service for her. But that is an aspect that needs to be strengthened. In medicine, we still prefer that we see our patients physically some of the time. However, it will really, really help a lot if we can also have a leverage on technology so that it reduces the utilization physically of the healthcare facility. It is convenient for the patient. You know that part of the cost of care is the cost of transportation.
Yes.
If somebody is to have a 15-minute consultation with a doctor, I don't think the amount of data used will be close to the amount the person would have used to take transport
to come to the hospital.
For us in mental health services, also, oftentimes, our patients need to be accompanied. So if you are talking of a patient coming to the hospital, you are talking of at least 2 people coming to the hospital. So that's transport fare for 2 people. So it helps to relieve the economic burden on the patient. So it's something that we must improve upon. It's gaining ground, it's catching up. It will only get better.
It will always get better. It will keep getting better. I know our time is fast spent, but then I just want to ask you before I let you go, what advice do you have for our viewers out there, especially Nigerians, concerning what we've just discussed?
You keep coming back to this.
Yes, I'm very particular about Nigerians because
there's no advice other than what I would advise myself, and it is for us to keep hope alive, for us to just hang in there make small adjustments. You
Mm.
know, if you wear a shoe and it is pinching you, you shift your feet in it a bit until you find a comfortable position. And that's what we all have to do, and do our best, do our part to make things better. Not to sound insensitive, I must acknowledge the pain that a lot of people are going through, the difficulty that this socioeconomic circumstance is putting, the strain it is putting on families, on relationships, and on people's mental health. But we must keep hope alive.
Right.
Getting to the point of hopelessness is I mean, it's a place nobody wants to be. What you should do, if I have to offer further advice, is to keep away from negativity. If you can't stand the heat, get out of the kitchen. You don't need all the breaking news. It's usually negative
Mm.
news. The media also should help us and stop screaming in the headlines with negativity. Every time there's negativity, can you please put a little bit of hope also into it? Oh, the tomato is now 3 million naira. However, Nigerians are turning to alternatives such as pumpkin
Yeah.
and whatever. That's the hope. But when you say it is 3 million naira and
How do we expect people to
you
survive?
don't put anything else there, it dampens. But when you put something else under it and the person looks at that and say, oh, thank God that there is an
Alternative.
alternative,
Yeah.
so that's what we owe to ourselves.
Thank you very much, Dr. Olusegun Soyombo, consultant psychiatrist, National Hospital. He has been here with us, giving us so much insights on mental health, coping with stress and pressure, especially here in Nigeria. We truly appreciate you, sir.
Pleasure
And
always.
thank you very much for
Thank
that
you.
enlightenment. Well, viewers, as we conclude our discussion on mental health in Nigeria, let us remember that seeking help is a sign of strength, not weakness. Let us continue to break down the barriers of stigma and silence and instead build a culture of support and understanding. Together, we can create a Nigeria where mental well being is prioritized and individuals can thrive despite the challenges. Remember, mental health matters, and seeking help is the first step towards healing and a brighter future. I am Promise Njoku Adibe. Until we meet again in our next episode of Health Watch, please stay safe. Bye for now.